Welcome to our presentation. My name's Paula Gray and I've worked for adult social care for around 20 years within Salford. Over the years, I've been part of a changing and developing service, and we are now part of the Integrated Care Organisation. And I am proud to be part of the leadership team who are developing services in one of our neighbourhoods. Today, we are going to share with you how we are addressing isolation and loneliness, facilitating community-led support and working in a strengths-based way. I'll hand over to Michelle to introduce herself.
Thanks, Paula. Next slide, please. Thank you. Hi, everyone. My name is Michelle Dennett, and I am the director of a Salford-based mental health charity called START. And we use creativity to support people's mental health and well-being through many ways, including things like social prescribing. I've worked with Paula now for about 18 months through an initiative called the Neighbourhood Leadership Forum in Walkden and Little Holton, which is one of 5 neighbourhoods in Salford. And this forum brings together leaders from a range of health and care organisations, including statutory services and the voluntary and community sector. The group meets monthly and comes together to understand the neighbourhood and how working collaboratively could improve health and well-being for the people that are living there. So it was through this forum that we came up with our vision, and that vision was to reduce isolation and loneliness, as Paula has said. So we aim to do this by putting the voices of those with lived experience of isolation and loneliness at the centre of all of our conversations. You know, we've got experts by experience all around us, and we want to give a platform to people to allow them to tell their story, supporting and encouraging them to have the confidence to use their voices to help influence changes. Next, we intend to improve relationships between partners by drawing upon the strengths of partners across the whole system, from adult social care, mental health services, the voluntary sector, including community groups and organisations. We can offer a comprehensive package of support, giving people choice and control over their care. And by building relationships with partners, we open up conversations for collaboration and for creative thinking, which leads on to the next point around empowering staff to be innovative. As someone who's worked within the voluntary sector for almost 15 years, I understand that charities need to be innovative to survive. We need to adapt to suit the demand of people and the groups that we are working with to be viable. And I think through working with Paula, I understand that historically things in statutory services are slightly different, and teams have traditionally been given less opportunity to use innovation in their work. And I think the work that we're doing together helps to overcome this. And then lastly, we want to join up good practice across sectors. You know, there's so much amazing work being done by so many people in Salford, and this has really come to light through working within the neighbourhood leadership team. So this slide shows a clip from one of our team meetings when the idea of a place in the community for different partners to meet and jointly support people was first being explored.
Looking at their carers' assessments here in a confidential but non-clinical environment, but also maybe a drop-in for the carers, so a real open, accessible place for the carers to come within their neighbourhood.
One of the reasons we came about this as a venue for creating a hub in the community all the professionals can use, all the voluntary sector groups can use, is a safe space for people in the community. It looks and feels friendly, it's non-threatening.
It's accessible.
It's absolutely accessible.
District nurses, have they said what they want?
So working with the health improvement team, maybe some others to do low-level kind of, you know, they might come and get the blood pressure checks or some weight, or getting information to healthy eating, healthy well-being.
We don't come under community mental health team, looking at what has led to them being referred to the community mental health team and what services, you know, there's possibly missing in the community. So it sounds like you're going to try and incorporate quite a fair bit of that into this hub.
I think the other thing we discussed as well is about somewhere for the leadership team to continue as well, so we could use that space to continue to meet as well, to review the project, but also for us to have that support and networking.
Support each other.
As a GP, people are lonely. The evidence says that they come more to see their GPs. So now I think with social prescribing there, I think it's quite useful for people whom we think are appropriate to be involved as a GP, whom I think are appropriate to come here, because if they're happier, they've got support in the community, they have activities to do in the community, they're less likely to suffer from low mood and other conditions or anxiety, and they feel more supported from the community, so they're happier generally.
It's fantastic to have a space like this for people of Walkden and Little Hulton, a non-clinical space where people can drop in and have access to information, services and activities, or be seen by health and care professionals outside of the usual setting area.
Thank you. Brilliant. Okay, so thinking about our journey together, the neighbourhood leadership team model has really built the foundations for mutual respect and trust, and encouraged relationships to be built between partners before any work on the ground actually begins. It was through these meetings that we first identified isolation and loneliness as a real need within our neighbourhood, which touched all of our provision in some way, shape or form, no matter what occupation or service perspective we were coming from. Once we identified this need, then we began to work through some solutions, and it became clear from very early on that in order to be successful in tackling this issue, then we had to work together. And as you saw in the film, to do this, we felt a physical space would really help facilitate this, bearing in mind that this was all pre-COVID. So through the neighbourhood leadership team, we secured funding to refurbish what was once an old shop unit in Walkden Precinct. And my charity Start obtained the unit a few years ago on a peppercorn rent basis. And up until this point, we'd worked very much on a shoestring to turn it into a usable space for our service users who may have had barriers to attending our main base, which was about 7 miles down the road. So the location was ideal, really. It's right by the big Tesco, Poundland, Costa, and just outside is a number of bus stops. So next slide, please. This is what it used to look like. So that's where you just saw the meeting taking place in the film. So working with the leadership team and our service users who regularly attended there, we began to design how the new hub might look like, and most importantly, how it might feel for people using it. The initial plans included separate areas to function as different things to different people, whether that be partners who needed one-to-one confidential space, groups who could meet for support and activity, or cosy corners from which to have conversations and a cup of tea. And this is what it looks like now. Next slide, please. So we've very recently finished the refurbishment. We've created 2 areas to informally sit, whether that be with friends or with support workers or community colleagues. Next slide, please. And there's also a listening pod from which to do confidential appointments or as a breakout space for groups who may need it. Next slide, please, and just over to Paula now. Thank you.
Thank you, Michelle.
Thanks, Michelle. So I want to move us on now and look at how and where community-led support sits within the social work values. We know that community-led support is not new and some services are already working in this way, but within our team we wanted to build on the already good practice joint working, and we want to deliver our services in a collaborative and co-productive way. Community-led support is at the heart of good social work, listening to people and what they need and they want in their communities. The leadership team are able to look at what we already have between many of our already existing services. We can use our knowledge and skills to connect people with people rather than services. But where people do need our services, we want them to be delivered nearer to their homes. We want to keep community assets within their own neighbourhoods. To give an example of this, we've been able to connect carers who are looking after their loved ones who ordinarily would have been going to day centre if it wasn't for the pandemic. These carers are now isolated at home. They have come together and have created a virtual group to support each other. The hub is already waiting for people to come together following the easement of lockdown, but for now we've been able to engage them virtually. Next slide, please. Looking through Strengths-based model, again, the model isn't new, but it's one that we very much want to focus on. We're moving away from a deficit model and we are working with people much earlier on. During the pandemic, we have had to consider our ways of working and we've had to roll our sleeves up and get stuck into practical ways of working. We're breaking down bureaucracy and breaking down some of the power and control that comes within our profession. We're acknowledging people are experts within their own issues and lives. One of the things that we've been able to do is to take direct referrals face to face within the hub, and sadly the hub isn't operational at the moment, but when it was and when we can, we really want to be able to take direct referrals so that we can meet with people and have good strengths-based, good quality conversations with people earlier on, identifying their strengths and not focusing on what they can't do, but what they can do. And we just want to show you a short video, one of a social worker who is practicing in a very strengths-based way, which is very different for her, and then a short video of a person with a lived experience who wants to share her experiences with you today. Thank you.
Hi, my name's Christina Connell. I'm a social worker for the Ward Integrated Care team. And I've just come to talk about the hub and how I have managed to complete some really good social work practice within this beautiful non-clinical setting. It's allowed me to work with people or deal with complex safeguarding issues, and allowed me to work with people and engage with people that would normally be quite difficult to engage with. For example, people who self-neglect or hoard. So it's allowed me to bring them into an environment that's not their own home, that they are able to kind of open up and be honest throughout the assessment. It's allowed me to gather people's history and complete person-centred assessments, looking at people's strengths and building strategies together. It's also allowed me to kind of bring people in that are socially isolated at this moment in time due to the pandemic, and complete some really good work with some service users. The hub is a beautiful, bright environment that's really informal, but also does have a professional feel to it. So yeah, it's been a brilliant setting and a brilliant place to work with service users.
Hello, my name's Maureen. I attend a group in a Start at Walking. They call it Start because it used to be called that after a place in Salford. But we've got our own little place here now. We don't need to travel too far. And if you feel that you want to come down, you're more than welcome. Don't sit in the house and be alone. That's what I used to do. There's people out there who will help people like us, and this is what the community needs. So don't despair and put yourself down. There's always somebody who's going to reach a hand out to you. It's not clinical. There's nothing here that says anything like rape crisis centre, things like that, or if you're suffering from dementia or somebody in your family. If you feel you want to talk about things like that, you're not pressurised. It'll come out of you yourself, like it's done with me over things. So please come down. There's some lovely groups to join. I joined the Living Group and I've never looked back. And my friends still keep in touch with me now, even from outside the group. So please come. We need people like you who are stuck at home doing nothing. You can meet friends, have cups of tea, biscuits, do whatever you want, or just come down and sit like me and have a cup of tea and don't join the group. But you know, they're there, you can watch and join in when you feel you want to. please come down. We need people here, and lots of support, and lots of people will help you. And just talk whenever you're ready. Thank you.
I'm aware, Michelle and Paula, that we are almost getting close to the handing over to our second speaker, if it's possible. Thank you for the final thoughts.
Yeah, just to bring it to a close. So we just wanted to share, as Christina was able to reflect on her practice and wanted to share her experiences, how she has found working in this strengths-based way. She's put down a briefcase and the 12-page document and a pen, and she stopped knocking on strangers' doors. She sat within the hub and met people face to face, having the first conversation with people in this neutral setting. And Maureen, who wanted to share her story, she wanted to show how the hub has helped her to overcome her isolation and loneliness at home. Next slide, please. So I'll just leave you to have a quick look at this slide, but we know that the impact that social isolation can have on physical and mental health is well documented, and the campaign to end loneliness points to research that shows loneliness can shorten people's lives, sadly. This slide demonstrates some of the facts that were found within this research. Next slide, please. This slide demonstrates some of the outcomes our project has managed to achieve, and whilst face-to-face meetings are on hold due to the pandemic, we have connected people virtually and they are supporting each other through this pandemic. Next slide, please. So to bring it to a close, because we are short of time, I just wanted to ask you to ask yourselves, is loneliness and isolation a priority in your areas? And if it is, what strengths can you use to make a difference to the people in your neighbourhoods? Thank you very much. Hope you enjoyed our presentation today.
Thank you.
Thank you so much, Paula and Michelle. And I'm now going to hand over to Lindsay Tanner from Oldham Council, and I hope, Lindsay, you're going to be much better than I was with the film, sharing the film. Thank you, everybody, for your patience. And I think I can't remember if it was Paula or Michelle mentioned technology. We are still getting to grasp some time with it, especially online live events. Lindsay?
Thank you. Yeah, well, it's just for me to welcome you. Thank you for coming. I've been really moved by the conversations we've had in Oldham, so I hope you will be too, even though this film is just a taster of them. It speaks for itself, really, so I'm just going to get going and share this 15-minute film with you. Hopefully, the technology will work.
It does.
Welcome to our film, to Oldham Children's Services, and I'm Lindsay Tanner, Principal Social Worker. The film, Unlikely Conversations in Unlikely Places, celebrating the breadth and depth of social work in Oldham. We didn't know the unlikely place would be Zoom, but even in these 15 minutes, you'll capture snippets of the amazing achievements of our young people, despite their challenges and having worked through those, and the wonderful rewards of social work practice here in Oldham. So enjoy the film, be inspired, and get in touch if you'd like to know more. Thank you.
My name's James. I'm the head of academy at Coppice Primary in Oldham. Nice to meet you.
Hi. Yeah. So I'm John. I've been in touch with social care since I was about 10 years old, but I only actually went under the care of social in like early 2018. Like I was just on the cusp of not being like in care. And yeah, so they've helped me get my own place, that kind of thing. And now I'm currently at uni with the help of one of my support workers, studying primary education. Like Oldham has like a really good like social care kind of branch. Like people from all over the place want to work for Oldham social care. Just because like, you know, what they do for the children and what they have the ability to do. At the end of the day, they're people, and a lot of people don't see that. Like they're there, they care for the children, they want what's best. And even if like it doesn't seem it at the time, you know, the decisions that they make have been through countless meetings with parents and workers and like obviously people like yourself, head teachers, like workers in schools, like they're all kind of at these meetings. and those decisions are made with like the go ahead of all of these, which a lot of people at home don't realize, you know. And then obviously afterwards, like I became very independent, and they even helped me with trying to figure out things like bills, because like, you know, you don't really realize how many bills someone gets to. You start living by yourself, and every 2 weeks it's like you owe somebody money. All it takes is a bit of like nurture and a bit of like understanding and like teaching them that. And I guess that's what social workers provide like a lot of the time, because they work directly with the children, and like, you know, people miss that, I guess.
Yeah, I think what you said there, John, the big thing is the support is there for people. Support is there.
Yeah, like if it wasn't for like social care, I wouldn't even be in university. I'd probably be working in a warehouse still. If I'd have had that kind of push earlier, maybe I would have like looked into it sooner, you know.
Hi, my name's Daniel. I'm 25. I'm a care leaver. I like with like aftercare and stuff like that really have helped me come through a lot.
So when you say they, Daniel, I mean, forgive my ignorance, but who are you talking about when you say they?
Oh, like social workers and PAs.
Oh, okay. So how old were you when you first got involved with those guys?
I was 15, but with like social worker, because I've been in care since I was 4.
So with the social worker that you've encountered there, in what kind of ways, how do you feel that they had a positive impact on your life?
Because basically like they've been there for me since the like younger age and stuff, and like I really trusted them. It's all about trust, really.
Yeah.
And like I really trusted them, and like I stopped and think about what I'm gonna say next, and like they literally like give me some good advice, and like they really like helped me like literally to get where I am now. Because I'm gonna work with like young kids as well, like literally, because like so I could tell my story to their story and stuff, and like.
Is this right? I've got that you are the ambassador for the Greater Manchester Youth Network.
Yeah.
Is that correct?
Yeah.
That sounds quite an important job role, that, Daniel. Do you want to just tell me a little bit about what that involves?
So basically, we do like cooking skills, working as a team building and stuff, and like we could work with like kids that are under like say 13-year-olds till like 20, like in the trainings and stuff.
I mean, I can see in your face as you're talking about that you've got a passion for it, and it's obviously lit something inside of you to give something back. That's really amazing to see.
There were many challenges I had to face, and I'm still doing. However, the standout one was leaving behind my home country, family and friends at a young age in search for a more positive and brighter future. For me, the challenges means finding out the meaning of such a thing. And as far as the concern with the change of environment goes, I have made another family and many good friends also here in England. I think the field of social work involves great experiences for both young people and social workers, as they both get the chance to share and learn about each other's life experiences. Yes, during my time in care, I had some great times I would like to share and reflect on. For example, the annual football tournaments for young people in care, a trip to the Lake District in 2011, a lot of activities to enjoy. Daily visits to gain updates on my progress were all very helpful, as they helped me to my journey to where I am today.
So I'm Callum, and I'm a student social worker in Oldham, and I'm on the frontline.
So I'm Callum, and I'm a student social worker. Why did you choose Oldham as a place to do the programme?
So I'm Callum. So I'm originally from Wales, and I moved to Manchester 6 years ago for a completely different job, and I've not wanted to leave. So Oldham was in my top 3 choice, purely based on location, really. I'm really glad that I have actually been placed with Oldham, because the teams that I've been working with, the social workers, everyone's just got the children and the families in mind constantly, and that's why, you know, I've chosen to get into social work. So in retrospect, it is the perfect fit. Every social worker that I've met in Oldham are in this job because they want to keep children at home, but they want to keep them safe.
Social work is the foundation really of what local government does, isn't it? And the point you made really resonates about caring. You know, we call the health and social care integration work Oldham Cares for a reason, you know, because we do. And it's, I mean, it is an incredibly challenging role, isn't it? And heartbreaking. And, you know, trauma-informed practice is really important, but recognising that social workers need support with dealing with that trauma themselves. You know, lots of aspects of this that I think are really important for the core social workforce, but actually extend right across, I think, Team Oldham.
We are Team Oldham. We're one team, and we've all, you know, got to do our part to make sure that the purpose of what we're doing, whether it's social care, whether it's teaching, whatever it is within Oldham, is for the greater good of those living in Oldham and those families that we're supporting.
Hi, my name's Zoe Talbot. I'm a foster carer for Oldham Council. I've been fostering for the past 8 years.
I'm Angela. I'm 19, and I'm currently in the under care from aftercare now that I've left foster care.
So you say your foster looked after you?
Yeah.
How's that?
It was all right. She was really lovely. There wasn't anything that she didn't help me with. She was like really nice.
Did you have a good social worker as well to support you?
Yeah. I had like meetings all the time with my social worker at the time because.
What did your social worker do to help you in that placement and help you feel more settled?
Just making like sure that me and the foster carer were on the same page with everything. Like, it was scary to be fair. And when I got pregnant as well, I was having issues with finding a place to stay. Even after I left foster care, I still had that support.
That really fundamentally is what social care and fostering should be about. It's about signposting people, being able to support them, being able to help so you can have better outcomes, and if you need help in certain areas.
My social worker made sure you had everything I needed. Because it feels like, just like, oh, you need this and you need that. I'm just like, what does that even do?
So where are you up to now in terms? Are you fully independent now and you live with your partner?
Yeah, we have our own house now.
Yeah.
Wow. Social services.
You've been on a journey, haven't you?
Yeah.
A right journey. Look how you're still smiling. So what would you say are good examples of social work then in your case, if you could think of something?
I don't know, it's probably just the support they give you. If they're just like there to call when you are struggling.
Did you feel quite confident to make those calls and ask for help when you needed it? And
yeah, because they're understanding because they know what you're going through. Like, they understand the situation that you've been put in and how you got there because they've worked with you. So like they know. Like, people go out of their way to make sure that I'm okay when they didn't have to. Like, I know it's their job, but they don't really have to be fair. It's not just the job for them.
No. What do you think special about Oldham Social Services? What do you think is good?
Well, they all work together as a team.
Yeah.
Different people from out of Oldham area, like all working together to achieve the same thing.
And it's that work together, isn't it? And again, putting the child's wishes and feelings, or the young adult's wishes and feelings at the centre, all coming together and working out what's best. I've had just really positive experiences of people who just go above and beyond and just really want to roll the sleeves up and just do what's best.
What's the support that you get from social services?
Yeah, so again, it's all about the support. And I have a supervising social worker myself, so the children have their own social worker, and I have a social worker who supports me, and the social worker will come out and visit me. So yeah, you do get very well supported yourself as a foster carer. You know, we have a social worker. There's lots of support for us also. Yeah.
do like social workers and the social care, do they train the foster carers or?
Yeah, there is training for foster carers. Yeah. Yeah.
Their training scheme, it must be incredible, because when the foster carers had before this one, because the ones I had now with like a different agency, but the ones beforehand worked for the actual Oldham Council, and the one before that did also, and they were both incredible. Yeah, they just help you blend into the family, don't they? When you did get a reliable social worker, they would like take to places, often they come see you, call to check up on you, and make sure that you do know that everything is being done by your best of interest. And that I had this one social worker, she was incredible, she was amazing, but unfortunately she had to leave at one point. But she'd like, if we say like, for example, when we first went to foster care for 9 months, and I really wanted to see my cousin, because I was really like attached to my cousin, I'd like to talk to him all the time. She had it sorted in like a week, me to have like contact with him to go see him. And I think that really benefited me a lot, which I think was really good, to be fair. Like when you get the reliable, really good social workers who are actually genuinely there for the job, that's when you start to feel the benefits of it.
Do you know what it needs? What you need to do to become a social worker or a PA?
I know you have to go to the office, you have to do the paperwork, like go to the meetings. I'm just based everything from around the child like outwards. Because in college I did do childcare in college. So I looked a lot into like safeguarding and stuff like that. And I think that's what mainly grasped me into being like part of that area, because when I used to go to like working in a placement, like working in a nursery myself, you just meet loads of children who are vulnerable to stuff. And you just wish that you could do more to help them.
I think social workers are amazing people that have a lot to deal with, a lot on the plate. Sometimes they have to make difficult decisions. Sometimes they have to put their arm around people and just give them that element of encouragement. But I would say if you're thinking about being a social worker, you're not aware of Oldham, I think, you know, we embrace the melting pot of different cultures, different races. You know, we're all different. We've all got different backgrounds, but the one thing we've got in common is we're proud to be from Oldham. And if you provide that social care for somebody in Oldham, I'm sure you'll get more out of it than you can give.
Lindsay, thank you so much for really insightful video. Thank you so much for also being really great with your technical skills. Excellent. And now, if that is okay, Lindsay, I'm going to hand over to our third key speaker today, which is Georgina Walton from Kent County Council. Hi, Georgina.
Hello, hi, Gina here. And I'm also joined today by Dave Harris. I'm just going to screen share. Dave Harris is going to kickstart us off. Hopefully you can all view my screen now.
Yes, we can, Georgina.
Okay. Bear with me, I'll just pop it into screen mode. Okay.
Good afternoon, everybody. Yeah, thank you for this opportunity. So Kent County Council at the start of the pandemic wanted to look for a solution, as we knew people that couldn't use technology and would be socially isolated. We needed a solution to keep people connected digitally. So we worked with our partners at Alcove and Rethink to develop the Cara video care phone. So we
Sorry,
expected...
Dave, just so you know, I'm having a technical problem in trying to move the slides along.
No problem.
Let me just come out and try and screen share again. Bear with me, sorry.
Don't worry.
Slides just did not want to.
Dave and Georgina, while we're doing this as well, if you can turn off your notifications in Teams, that would be really helpful, because we're getting lots of beeping coming through. You need to set yourself to do not disturb. If that's too complicated, don't worry. But if you know how to do it easily, that'd be great.
Yeah. Right. Okay. So it should be in screen share now. Can you see my screen?
Yes.
Yeah. For whatever reason, though, we've got a lot of technical problems in Kent today where our systems are not playing ball, and I for whatever reason, cannot move the slides on.
If you go to the slideshow at the top.
Yeah, it's just nothing's working. It's not. It's yeah. As I say, I'm sorry. We're having a few technical problems today where our system just seems to be really slow. And
you want me to try, Gina?
Yeah, if you're able
Georgina,
to.
Dave, I also have the presentation ready. Yeah. Hopefully I can share from my screen and just let me know.
Course.
Lovely,
yep.
thank you.
Absolutely, yeah, if you'd like to
and
do that.
I'll hand over to Dave, just continue talking whilst you do that.
No problem. So Kent bought 2,000 video care phones. They are Samsung Android tablets, and our partner Alcove have wrapped their software around the device, which means that you can only make and receive video calls via the device. We know that iPads are being rolled out, but they're quite complicated. And we thought the main cohort were going to be elderly frail, who were also going to be at risk of shielding. So early on, we developed the rollout of this device, which is very simple and easy to use. Individuals could connect friends and families, and it would just be a series of tiles on their screen that they could click and connect through to. The device is also whitelisted, which prevents and mitigates the risk of cold calling, because the individual can only call the people that they've agreed to be on the screen, and only those people can call them. We quickly expanded the cohort to learning disability, autism clients, and recently have worked with our health colleagues to have them at the first part of supporting timely and safe discharges. A number of static devices were also given to residential care homes. So although the vast majority of the people receiving the video care phones have an eligible social care need, we've also provided support through public referrals for people that meet the criteria. A, they cannot use alternative video technology, and B, are at risk of social isolation. Our social workers have increasingly been using the devices for doing virtual safe and well checks, assessments and reviews. Now, this has been particularly important for our best interest assessors who haven't been able to go into residential care homes to cross the threshold due to the pandemic. So this has enabled our team to work through the backlog that was growing of best interest assessments. Also within the hospital wards, to help facilitate safe and timely discharge, our social work teams can now link through to static devices that are within the office of the ward. The device is then taken to the patient, and that review, assessment and safe and well check can be facilitated. So if we can go to the next slide, there's a lot of detail here. The slides will be shared with you, but just a few indicators of the feedback. Some of the learning disability clients that have received it have really welcomed it, because they've been able to talk to friends and family that they haven't seen for a significant period of time. And here are a few examples. Again, we will share these. I just want to give you a few that we've heard from our in-house teams. The sensory team, for example, had found even doing physical visits for someone that had a hearing impairment and maybe relied on lip reading is very challenging with the masks and wearing the masks. But with the video care phone, because it comes on a stand, the British Sign Language has been possible. So through a virtual visit, both the client and the workers have been able to communicate clearly and well. Where also the static devices have been in residential care homes, it's meant it's kept the main line free for GPs and family to get through, as well as being able to set up friends and family connections on the video care phone, which can be then taken to each of the clients. The contract was originally for a year through until April of this year, but it's just been extended through for another 12 months, which takes us through next year's or this coming year's winter pressures. The device is SIM enabled. It can work on Wi-Fi, but as part of the solution, Kent County Council wanted to make sure that individuals who didn't understand technology and wouldn't necessarily have broadband were still able to use it. And of the just over 1,200 devices that are now actively being used, we've only ever had 2 instances where someone wasn't able to get a signal at all on the SIM. It is free at point of use, and will remain so until what's likely to become part of a standard digital offer for Kent, at which point with next year's telecare digital contract relet, at that point any charging considerations will be made. But what we've seen over time is that it's not only impacting the individuals, but it's also, as we're all embracing virtual technology as we are today, it's changing practice. So I'll hand over to Gina, talk a bit more about that.
Lovely, thank you. Thank you for going on to the next slide. So Dave has just covered the technology that we have put in place, but now I'm going to talk a bit more about how we've had to work to change our culture and practice. We're learning, technology is evolving, and we're constantly learning. And I have to say we've been on a real journey since we've implemented the device that Dave has just described to you all, very much around our culture and winning the hearts and minds of our practitioners in terms of how they embrace digital solutions and how they utilise these digital solutions in the way that they support people, but also in the way that they practice. And what we've found since implementing Cara, not only is it a really effective tool in supporting people and complementing the care and support, but very much as a key workforce tool, which Dave has alluded to, in how the device has really helped our practitioners change the way that they work. But we've had to do a lot of work with our practitioners to help them understand the benefits of technology, but also in terms of the approach in our care and support planning and how we consider first not only our communities and what's on offer to support people within their community, but then also to really think about what technology and digital is in place. And our practitioners to feel confident around being not only aware of what digital solutions are in place, but also to be able to bring those digital solutions into a care and support planning conversation. So what we've put in place, not only are we looking at our practice approach in Kent, and we are currently developing and testing a new practice model. We have a huge programme of work underway at the moment in Kent, which is focusing on 3 key pillars. So one is practice, which is what I've just mentioned, that we're looking at our practice model, innovation, and looking at how we are innovative and we support that continuous improvement, and also meaningful measures, ensuring that we have access to the right information, the right data to inform our decision making. To support our practitioners, we are introducing technology facilitators who work very closely with the operational teams. So our practitioners will be able to work and access support from a technology facilitator to explore the different solutions that are available on the market and how they can be introduced to the people that we support and how they can complement someone's care and support. And in addition, it's not just only our practitioners, but it's about how we support people to be able to access and confidently use digital solutions, because we can put all the technology in place, but if the people that we support are not able to utilise those solutions, we're going to fail. So what we've introduced is digital ambassadors. So these are a group of volunteers within communities who are trained up to be able to work with people and understand the different learning styles. And then they go and work with people in the community to not only build up their skills around using digital solutions, but also take out technology boxes to showcase the different solutions that are available to people, and do some demonstrators and allow people to be able to have a period of time where they can test different solutions to see what works for them. So we've recognised that technology has a role and can really change the way that we support people, but also the way that we work. But we need to make sure that we've got the structure around it to support people. That is both within the operational teams and working closely with our practitioners. And that has meant we've had to change our practice and approach, and also make sure that the right support is in place within the community. Now, we was going to open up for questions, but I don't know if that's possible within the time that's available.
I'm aware that I think we already the plan time. However, I will encourage all the participants, and I'm mindful that we're around 140 at some point in this meeting. That was really impressive. I will encourage them, if they have any questions, maybe to contact you and Dave directly, if possible, Georgina. There was information on the presentation, and I just want to say a big thank you to all of you, to Paula, Michelle, Lindsay, Georgina and David, for very insightful presentations. I really hope that everybody enjoyed this session, and I will encourage you please to complete our survey and give us feedback. And also, if you are by chance a social worker, and probably some of you are, please also consider using these sessions, a really amazing information connecting with me as a previous adult social worker as well, and loneliness and all of those aspects, and digital technology today allows us, isn't it, to hear quite a lot of interesting noises as well from people's families and backgrounds and so on. But once again, thank you to all of you. I hope you really enjoyed this session, and consider CPD if you want to reflect part of the whole session, or part of the session you might want to make reflection for your CPD logins.